three movements: horizontal movement, vertical movement, and pivotal movement. First, horizontal movement, meaning the eyes can move across the back and forth along the horizon in an abduction and adduction rotation. Focus on the right eye. The right eye is abducted, and then it's adducted. Abducted, it's away from the midline or the nose. Adducted, it's the eyes now towards the nose. Next, we've got the vertical movement, going up and down in a vertical plane. So elevation and depression, looking up. The eyeball can look up, or elevation in the y-axis, or down, depressed in the y-axis. Up, down, or elevation, depression. And then finally, a pivotal movement, or intorsion and extorsion, or intorsion and extorsion. This is an interesting one because this is one where the eye rotates along itself. So if I just add these cross beams there, you can see now this eye as it rotates through a plane, through the crosshairs, right into and out of your screen. An example of this is when you rotate your head. When your head rotates one direction, your eyes torque in the opposite direction. And so if you see your head tilting towards its left, both the eyes rotate or towards the right. This helps binocular vision. So now that we've got those movements, let's look at the extraocular muscles and their innervations. So on the left-hand column, we have the abbreviations for superior rectus, inferior rectus, medial rectus, lateral rectus, or four straight muscles, and our inferior oblique and superior oblique are two muscles that attach to the eyeball at an angle. And along with that of the screen, you see a superior view of the right orbit and an anterior view